Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. Today you're going to learn about FASD, Fetal Alcohol Spectrum Disorder. Our guest says that this is the number one preventable cause of developmental learning and intellectual disabilities in the world. Prenatal exposure to alcohol affects 1 in 20 of us, and yet seldom diagnosed, having many overlapping characteristics with more commonly acknowledged disorders. My guest today is Patricia Kasper, the self-proclaimed FASD Coach from Patricia Kasper Training Services. She provides FASD-Informed Approaches for professionals and coaches, parents of children affected by FASD. She is also the host of the podcast, Living with FASD. Patricia, welcome to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you. It's very good to be here. Thank you for having me.
Tell us, how did you begin your journey with this topic of FASD?
It's only been a handful of years. I just turned 60, so leave it to me to find my passion at nearing the sunset of my career. But it's really built upon a lifelong journey.
Great.
I began my career in addictions and then mental health while I was living on the East Coast, Pennsylvania, Virginia, Tennessee, in those areas. And then I met my husband online, and he's stuck out here in California in the oil fields. My job was more portable, but the laws are so different. It meant that I switched hats back to my undergrad focus of social work. And so I've been in child welfare for almost 24 years now. And because I have such a varied background, I really dive into anything that is going to help me better provide services to the youth and the families that I serve. So for 24 years, I worked for a nonprofit in the foster care space. And I got tired of watching kids fall through the cracks. And I got equally tired watching foster parents give up because they felt ill-prepared to take care of children with the magnitude of behavioral problems that some of them did. So I did a number of things. I took a lot of trauma training under some of the nation's, top people. And I became a TBRI practitioner, which is trust-based relational intervention. That's the brainchild of Texas Christian U and the late, great Dr. Karen Purvis. But it still felt like something was missing. And so that's when I stumbled into a program called FASD, which is Fetal Alcohol Spectrum Consultation Education Training Services. And it was in the process of training with them to become a certified facilitator of their neurobehavioral model that I was like, well, this symptom seems familiar. Oh, I do that too. Oh my goodness, I'm really resonating with that. And one of the first exercises that they had us do in the program was an exercise geared to normalize conversations about neurodiversity, which is the idea that all of us are wired in unique ways because there's such stigma about the brain. Really, it's just another body organ. But there's such stigma about it. So anything we can do to normalize conversations about not every brain functions exactly the same, is valuable. Yeah. And the homework was go do this exercise with your family members and start practicing having those conversations. And my mom lives with me. I'm her primary caregiver. She has Lewy body dementia, which is another fascinating topic. If you want to have me back for that one, like FASD, it is extremely common and diagnosed extremely rarely. Anyway.
Yeah. So tell us what FASD is.
Yeah. So Fetal Alcohol Spectrum Disorders, it's an umbrella term that has actually several diagnoses underneath it. FASD in itself is not a diagnosis. But, my husband very sarcastically said as he passed through the room, hearing me talk to my mom, "Oh, that's what's wrong with you." And I was like, "What?" And I turned to my mother and said, "Did you drink while you carried me?" And she's like, "Oh yeah, every day," with such surprise in her voice, like, who doesn't? But it was the early 60s. Nobody knew any better. Fetal alcohol spectrum, which is one of the diagnoses under that umbrella, was not discovered as a thing until 1973. More than a decade after I was exposed to alcohol. So FASD is a variety of impacts of prenatal exposure to alcohol. Right?
So tell me, when you're talking about FASD, how is this diagnosed?
So it is a medical diagnosis. Although there is one diagnosis under the umbrella that you can get there through developmental or through counseling. It's in the DSM. But for the most part, it is a medical diagnosis because it is a physical disability. It just happens to have behavioral symptoms. So among others, alcohol will impact whatever happens to be developing at the time of exposure.
So give me some of the characteristic symptoms. Like, how do you know that you have, and why? On that note, why are so many people underdiagnosed?
Well, it is underdiagnosed because the behavioral characteristics look a lot like the characteristics of autism or ADHD. And truly, you can have both or all three. And among many other diagnoses, that there's a lot of overlapping symptoms. One of the reasons is because it affects everybody so uniquely. If you've met one person with FASD, you've just met one person with FASD. Like I said, it affects whatever is under construction at the moment of exposure. So the brain takes the biggest hit because the brain is developing throughout the entire pregnancy, every single day of pregnancy. Whereas other body systems have their risk of exposure within that timeline. For instance, it can affect the teeth formation, right? If alcohol is consumed while your teeth are being formed or your jaw, you can see a lot of effects from not having enough teeth or having too many teeth or having teeth that are fused together or not having enamel on the teeth. It affects every body system. In fact, there was a fairly recent survey that was done that has shown there are 428 comorbid conditions that run with FASD, meaning if you have exposure to alcohol prenatally, then you stand a much greater likelihood of developing these 428 conditions than the general public. So that was a fascinating survey of several hundred adults, like 700 maybe, adults living with FASD, and then comparing the prevalence rates within that pool with the prevalence rates of the general population using statistics from the CDC. And so the risks of numerous physical conditions are much greater. We'll see a lot of conditions that are normally associated with older adults happening to much younger adults with fetal alcohol. For instance, early onset dementia. If you have FASD, you are at a greater risk by 206 times of developing dementia at an early, prior to age 65. And why that's the case is not exactly known. Mm-hmm. My theory is that one of the characteristics that a great many people with FASD have is the inability to track the passage of time. It's not being able to understand that concept of time being fluid and moving on. So if you're not physically watching the clock, it ceases, time doesn't move.
So it affects your cognition. Does it affect your behavior?
Absolutely.
It affects your behavior as well?
It affects your physical development. It affects your emotional maturity and emotional development. It affects behaviors. There are 9 categories of what's called primary characteristics. If you look at all the work from Dr. Ann Streiskuth, who she recently passed away just a few months ago, but she's one of the pioneers in the field. She breaks down primary characteristics, which are those behaviors that directly reflect the changes to the brain. There's also secondary symptoms and tertiary symptoms, and those are all mitigatable, right? Through accommodations. You can prevent those, you can reduce those, you can even eliminate them if they've started. Those are the symptoms that call attention to a child's plight. They're the symptoms that get kids into counseling or into juvenile justice.
So you talked about the mother consuming alcohol.
Yes.
What is the amount of alcohol do you think that would predispose the unborn child to this syndrome?
Even 1 drink twice a week through a portion of the pregnancy can cause significant damage. According to the CDC and all reliable research done in the past few decades, there is absolutely no safe time within pregnancy.
And this is any kind of alcohol. You're talking beer, wine, anything that you're taking.
And so my mom was told, wine's good for the baby.
Right.
That's not an unfamiliar piece of advice, but it's just not true. It hasn't been borne out. Neuroscience has really advanced in the last 20, 25 years, and it has disproven a lot of those old adages, like it's okay to drink till it's pink, right? You can drink up until when you find out that you're pregnant, but by then the damage is done. People are familiar with fetal alcohol syndrome, which is one of those sub-diagnoses. With FAS, with fetal alcohol syndrome, you will see characteristics in the face, like small eye openings, or this space, the philtrum between the nose and the upper lip, is oftentimes elongated and it's flatter, and the upper lip is often next to non-existent. If you have those 3, or even if you have all 3, then you're going to get the diagnosis of fetal alcohol syndrome, and you don't need corroboration of a parent's admission to drinking in order to warrant that, because you can see it. But that's only 10% of people on the spectrum that have those changes to the face. And those changes only occur if alcohol is consumed on days 17 through 21. That's it. 5 days.
Wow. So, and not to interrupt you, but when you talk about FASD in comparison, or talking about autism spectrum or the other types of diagnoses that are similar, how do we make the distinction here without diagnostic tests or evaluations to say unequivocally that this is FASD?
Unequivocal, you're going to need confirmation from mom that there was prenatal history of prenatal exposure to alcohol. That's the only way to get the unequivocal. It's got to be documented somewhere, or you have those characteristic changes to the face. The problem with the dysmorphology or the changes to the facial structure is that as we get older, our faces change, right? We would be looking very odd if we had adult bodies and still had the face of a 6-year-old.
Yeah.
Or a 6-month-old. So as we mature, particularly with adolescence, when those changes start advancing very quickly, those visual symptoms tend to disappear.
So
they become less prominent.
So what is the beginning of helping someone, either the parent or the child that has FASD? What are we doing for them?
We've really got to get better at screening. This should be screened across the board for every child, whether they're in foster care, whether they've been adopted or not, because I was in nursing school back in the early 80s. One of the first things that I learned in maternity rotation is that up to 1/3 of women, I don't know if the statistic has changed or not, but up to 1/3 of women still get their monthly cycle for the first trimester. So if you're still getting your cycle and you don't have the morning sickness, because not every woman gets morning sickness, then you're not going to realize you're pregnant until the 3rd, sometimes the 4th month. And you're going to continue, if you're a social drinker, particularly if you're on a college campus, you're going to continue doing those things and exposing your child. I mentioned that the facial changes occur if alcohol is consumed days 17 through 21. That is well before women know they're pregnant. The best way to prevent FASD is to make a choice.
Yeah.
Right? If you're of childbearing age, if you're capable of reproducing, you choose alcohol or family,
right,
or you use a very high-rated method of birth control. Birth control is very fallible, particularly if it relies on us to be consistent. If we're in college, we're often not as consistent as we would like to be. So it's just very important to be intentional about family planning if we're in childbearing age. But it's not just women. There's a lot of research out there that shows that fathers drinking in the months leading up to conception can cause irreparable harm as well. Can also cause changes to the baby's neocortex, which is that thinking part of the brain, and cause a lot of the same damage. We don't call it FASD because dad's drinking doesn't cause the baby basically to be swimming in alcohol, but it causes a lot of the same damage. So also it will, if a father is using substances, it can change the epigenetic code and make a child very prone to developing addictions of their own in the future.
You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about FASD, Fetal Alcohol Spectrum Disorders. My guest today is Patricia Kasper, the self-proclaimed FASD Coach from Patricia Kasper Training Services. She provides FASD-Informed Approaches for professionals and coaches, parents of children affected by FASD. She is also the host of the podcast, Living with FASD. So tell me, is there any kind of genetic factor that makes an individual more susceptible to FASD?
There's not been a gene labeled as such, but we do know that drinking and drug use tends to be generational. In part, that's environmental because kids grow up learning this is how we cope with stress. This is how we cope with adversity. But in part, it is also that genetic and epigenetic, hand-me-down effect from what our parents had been doing before and during our time in the womb. Alcohol will affect any aspect that is under construction or being developed, whether it's structural formation or whether it's functional development.
I was thinking on to that. I was wondering, is there a certain time in the pregnant woman's pregnancy that the child is more vulnerable? Would that be the first trimester, or it's just throughout the pregnancy that we see that the child is vulnerable?
It's throughout because the brain is developing throughout the entire pregnancy and beyond. So if a woman is drinking while she's breastfeeding, she is still causing
exposing
harm to her child's brain.
Yeah.
And one of the key things that I want to highlight is let's not blame mom. Let's not blame mom. It's the alcohol that does it.
Yes.
Right? There's so much misinformation out there that it is not fair to blame parents.
So let's talk about management. How are we managing the child with FASD? Whether it be medication, whether it be behavioral, whether it be any kind of cognitive therapies, what are we doing to help these individuals?
Not enough. Neuroscience has really taken off as a field in the last 20, 25 years. And we're catching up with the things that we're learning about brain development. Unfortunately, our systems of care, whether it's mental health or whatever, are still operating under older paradigms, which basically it's the behavior paradigm, which says all behavior is intentional, right? If we're doing something, we can see the benefit, or we're going to turn over some rocks and find the secondary gain, right? There's obviously a benefit some way, or the child would not be doing this. And the idea with behavior management per se is that if you offer the right bribe or threaten the right punishment, the child is eventually going to choose the behavior you want them to. And that just isn't the case if you have a brain-based condition. Behavior truly is a reflection of how well your brain operates. And, I said earlier about primary characteristics. The categories of behaviors that we see that are impacted are language and communication, sensory systems or sensory motor integration, the ability to process abstract thinking, the ability or executive functioning is another, which is, in the last part of our brain to develop to make those higher level cognitive functions, right? Being able to make decisions, being able to predict outcomes, being able to plan, all those things can be affected. And the reason why FASD looks so different among each individual is no two babies have the same combination of risk factors and exposures. So much depends on the timing of the alcohol exposure, on the dose. Was it a half a glass of wine, or was it a full 6-pack, or was it a fifth of liquor? The dose of alcohol makes a big difference. The frequency of alcohol exposure makes a big difference. So does adding in any other substance, including cigarettes.
So we're not giving a medication to treat this, or we're not doing any cognitive behavioral therapies for these individuals.
So cognitive behavioral therapy can work with some, but not with a great many. Again, it depends on how each individual is impacted, right? If you cannot predict consequences, if you cannot do the if this, then that equation in your mind, then cognitive therapies are going to be less effective. You're going to see problems with impulsivity if you cannot predict outcomes. If you can't predict, if I do this, then so-and-so is going to get mad or I might get arrested. There's nothing to stop us from acting on those impulses. Does that make sense?
Sure. Now, if you have someone that this sounds very familiar, these symptoms, they sound very familiar. How do I, or where can I find resources? Do you have a resource that you can share with the listening audience about the FSH?
The primary one is going to be FASD United. That is a nationwide nonprofit. They are behind a big push currently in Washington to get the Fetal Alcohol Spectrum Disorder, FASD Respect Act passed, which nationally will codify it as a physical disability that is equally deserving of accommodations as any other physical disability.
That's good.
Right now, FASD is classified, more as mental health and behavioral and considered a disorder, but that's really not fair because impacted people who are living with it, they didn't do anything to cause this. They're having to play the hand that was dealt them, which means that they have cognitive challenges. Underneath any behavior you can do, there's a whole litany of brain tasks that have to happen.
So is there a website that we can go to find
FASD.org is one.
And give us your website as well.
It's patriciakasper.com. Kasper's with a K. So patriciakasper.com is one. Certainly listening to the FASD podcast is one. Picking up a copy of my book is another way for adults.
And what is the name of your book?
It's called Sip by Sip, Candid Conversations with People Diagnosed as Adults.
Can I find that on Amazon?
You sure can.
What would be the one thing that you would leave us with about FASD?
To realize that it's 1 in 20. Everybody listening knows several people who are impacted, and you don't outgrow it.
Well, we want to thank you for being here, Patricia Kasper, the self-proclaimed FASD coach from Patricia Kasper Training Services and the host of the podcast, Living with FASD. We hope you stay healthy and continue to do the great work. And thanks for being with us today.
It was my pleasure. Thank you for having me.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.